Good morning, friends, brothers, and sisters. This morning, today, July 16th, 2025, I'm going to talk about common side effects of blood pressure medication. Lots of folks out there, they are on blood pressure medication. Why you need to know the side effects of the medication? Do you take medication for high blood pressure? If you do, you need to hear this. So, we know that high blood pressure medications saves life. It prevents stroke, it prevents heart failure, it prevents kidney failure. But every class of medication has side effects, and many patients stop taking them because of symptoms that can be managed or prevented. So in this video, I'll break it down class by class, so you know what to watch for and how to protect your health. So let's see. Number one, diuretics. Diuretics make you pee more, but what else? Water pill like hydrochlorothiazide or hydrochlorothiazide triamterene combination or chlorthalidone, you can have side effects. They're called thiazide diuretic. They're sulfa derivative. So if you have sulfa allergy, you cannot take that medication. It'll cause frequent urination, but it can also cause low potassium, hypokalemia, which can cause muscle cramps, weakness, and if hypokalemia is severe, it can cause heart arrhythmia and many other issues. It can cause dehydration. It can cause high uric acid, leading to gout flares. It can also increase your blood sugar, and some people mild elevation of cholesterol as well. And some cases, it can also cause calcium imbalance. So make sure that you check your potassium, check your calcium, stay hydrated, and your kidney function is right. So I usually do is every few months, once I start the patient, I check it renal panel to make sure those numbers are good. Number two medication very commonly used is called ACE inhibitors, and one of the common side effect is cough and swelling of lips and tongue. So if you have a coughing because of blood pressure medication or something you started but you're not aware why all of a sudden you have cough, and the distinctive nature of this cough is that you have tickling sensation in your throat, and the cough is hacking in quality, and it just comes from nowhere. And so ACE inhibitors like lisinopril, captopril, enalapril, benazepril, everything ending in the pril, they're very effective medication for blood pressure, but they can cause a dry or persistent cough. In that case, you have to stop the medication. It can cause dizziness, and it can cause also high potassium, which needs to be monitored by your doctor by doing a basic chem panel. A rare and a serious side effect is called angioedema, which is the swelling of your lips, tongue, and throat. I used to work in a hospital as a hospital doc for many years, and every now and then would see a patient like that presenting in the ER with those kind of symptoms. If that happens, you have to stop the medication, get the treatment, usually Benadryl, Claritine, or sometimes even steroid tablet like a prednisone, and never take that medicine again. You should seek help immediately. Sometime if you have tongue swelling, throat swelling, you have to go to ER. But it's just the lips swelling slightly, then you are good. You can wait to see a doctor next day or go to urgent care. Since you stop the medication because of the side effect, you have to also get a different sets of medication for blood pressure control. Other medication we use commonly is called ARB, and those medication like losartan, valsartan, olmesartan, telmisartan. So all those sartan, those are classified as ARB. The people who have cough because of ACE inhibitor like lisinopril kind of medication, usually we switch them to ARB because ARB does not cause coughing issue and does not cause edema, angioedema. But they can still cause dizziness and high potassium. So and the renal function has to be monitored. Calcium channel blocker is another common medication we use, and those medications like amlodipine or Norvasc, verapamil, diltiazem, nifedipine, those are calcium channel blockers. Amlodipine is a medication quite known for causing ankle swelling. If that happens, you need to talk to your doctor, find out whether you want to stop it and change to a different medication, or you want to continue it because your swelling is very mild. In some cases, swelling is very severe, and we have to stop the medication. Verapamil is a calcium channel blocker, but it also slows the heart rate, so you have to be careful combining with the beta blocker. Same thing with the diltiazem. They're calcium channel blocker, and unlike amlodipine, they also slow the heart rate. So all these class of medication, calcium channel blocker, they relax the blood vessels, and they can cause swelling. They can cause fatigue and constipation as well. Verapamil is quite known for constipation. So you have to be very, very careful, and you will let your doctor decide. If that happens, swelling, elevate your legs, stay hydrated, talk to your doctor, and make adjustment in a dose of medication or change to a different medication. If you're on beta blocker, which also slows the heart rate, and if you happen to take verapamil, diltiazem, that must be monitored by a doctor closely for bradycardia, which is slow heart rate. Beta blocker, good for the heart, but it can cause fatigue. And if you're tired all the time, so you have cold hands, it might be beta blocker. Common medication, metoprolol, atenolol, carvedilol, sotalol, they slow the heart rate and they reduce the pressure. Common side effect is fatigue, sometimes depression or low mood, cold hand, feet, sexual dysfunction, weight gain in some cases. They're great for post-heart attack, but not always the best for basic blood pressure alone. So, but you talk to a doctor. I usually don't use beta blocker because of that reason, and it also has sexual side effect. So I try to stay away until somebody's heart rate is high, somebody has history of anxiety, and somebody has history of heart issues, history of coronary artery disease. Other medication we use is alpha beta or central agents. They are clonidine, methyl dopa, prazosin. They are less common and not that commonly used. It can cause drowsiness or brain fog, dry mouth, constipation. It can cause rebound in blood pressure if you stop it suddenly, and depression can be caused by clonidine and methyl dopa. So you should take this medication as advised by your doctor, and don't engage in sudden withdrawal of the medication because of the rebound effect. Sexual side effect is very common with the blood pressure, particularly beta blockers like metoprolol and atenolol, and diuretics like hydrochlorothiazide, chlorthalidone, or Maxide or Thiazide. It causes erectile dysfunction, decreased libido, and performance anxiety. So that's why ACE inhibitor like lisinopril or ARB like losartan, they're the better medication comes to blood pressure. And so be careful, know your medication. Is very important to know what are you taking, why you are taking. Spend time knowing your medication and knowing the side effect. More you know, better it is. You are in command, you are in control. I like to educate my patient, spend time with them, and take your medication as prescribed by your doctor, and make sure you monitor potassium and kidney function and your pulse rate. Thank you for watching. I appreciate each and every one of you for following me and liking me. I'm Dr. Pankaj Karan, board certified internist in California. I've been practicing here for the last 30 years. Have a great day. Thank you.